and those are the folks who can least afford the cost of health insurance. No matter what we try to do about changing the cost dynamic, in the meantime, it's unattainable for a lot of small businesses, which translates into those employees who can't get covered.
Thank you very much. That was Senator Joseph Vitale, and you're joining us on a live teletown hall with Congressman Frank Pallone and Senator Vitale. We're talking about health care, and we're taking your questions live. If you have a question, you can press *3 on the phone, and we'll take your question. We're going to go now to Diane in Ocean. Diane, do you have a question?
Yes, I do.
Go ahead.
You've been talking a lot about general assistance, and I'm a nurse, and I'm also a senior. I luckily have insurance of my own, but that is not my question. I hear a lot of talk about covering everybody. I think this can't be done. With the general health status of most Americans, we can't cover these people as they get old and sick because they eat junk food and cigarettes and a heavy meat and dairy diet all their lives, and they're going to have very complicated later in life, and it's going to cost a lot of money. And the people who are getting most of the money in healthcare, not the doctors, it's the people who are getting most of the money is the pharmaceutical companies and maybe HMO executives and the medical device companies. We have to do something about both prevention and we have to do something about the way healthcare funds are allocated.
Okay, thank you very much. If I could just take a moment and try to repeat that because we had a little bit of problem with the phone, but I think Diane is talking a lot about programs that might encourage more wellness in our healthcare system and rewarding perhaps better life choices.
Well, Diana, this is Frank Pallone again. First of all, I would say that prevention is a very important part of this healthcare reform that I've discussed. I don't know if you were listening earlier, but I would say this. I mean, first of all, if you cover everyone, if everyone has health insurance, which is the goal of this healthcare reform, then automatically you get sort of a preventative nature of things because people now who only go to the emergency room, for example, when they get sick, would see a doctor on the regular basis. So part of what we're trying to do here is to make sure that you can go to a doctor on a regular basis and don't just wait till you get really sick and end up in an emergency room or be hospitalized. And that part of that being able to see a regular doctor would also involve preventative things. In other words, your doctor would tell you, look, you're too fat and you need to reduce, or you need certain prescription drugs that are not available to you now because you just didn't even know about it. But beyond that, we're also building into the healthcare reform some preventative measures. In the stimulus package that I mentioned before, not only is there health information technology money and money for comparative effectiveness, but also for prevention and wellness programs to try to build into the healthcare system, that people have a certain diet, that they don't overeat, that they have healthy diet with fruits and vegetables and that type of thing. And it may very well be that we actually, through demonstration programs, link, reimbursement rates in some way to prevention. So we're very mindful of it, and I think it's very important, and I do appreciate the fact that you brought it up.
Thank you very much. That was Congressman Pallone. For those on the call, we have a poll question we want to ask you right now, and all you have to do is press either 1 or 2 on your phone, just those numbers, not the star key. I'm going to ask the poll now. Have you been affected by a preventable medical error? Have you or your family member been affected by a preventable medical error? Press 1 if it's yes, and press 2 on your phone if it's no. So have you been affected by a preventable medical error? Have you or your family been affected by a preventable medical error? Yes is pressing 1, and no, press 2. Now we'll take a call actually about this issue from Roy. Roy, you're on the phone. Would you like to ask your question?
Yes, basically, I've been through many different situations, and I won't go into all the details, but it's affected my daughter at age 22, it affected
Vitale, and there are dozens of potential mistakes, whether they're medication errors, wrong blood given to a patient, wrong type of surgery performed on a patient, the wrong limb removed. I mean, the most extreme cases and the most subtle cases. And so we've been trying to really encourage, in a way, through means that are in some ways sometimes punitive to our hospitals, but also allow them to make those corrections in another way as well. We care about patients first, and we care about hospitals as well, but they're sort of next on the list. Patients are there for a purpose, and to get well and to be treated. And the errors that occur, the most egregious errors, those that are absolutely preventable, absolutely should never happen. And there's national data and very smart people who understand which errors should never, we call them never events. And so there are nearly a dozen of them or more that should never happen, and which means they should also never be paid for. Particularly the original event that was incorrect, and then the corrective procedure. The hospitals have to take some responsibility, as does the physician. When many of these errors take place, it's not just the hospital's fault, because they have a protocol in place. They have a procedure that they have to follow. And when the doctor doesn't follow that protocol or that procedure and bad things happen, the doctor shouldn't get paid either. And so there are two entities, both the hospital and the doctor, both at the same time or individually, that shouldn't be rewarded for what is really poor medicine. And so we're cracking down in New Jersey, and other states are looking at our example, but we don't think that's the right thing. And so this financial penalty, this would provide the kind of incentive to make sure that they do it the right way the first time, so that they can actually get paid, because A, they did it the right way, and B, they should get paid for doing it the right way. But the first thing is that patients aren't harmed, and that the right procedure gets done correctly.
Thank you very much. That was Senator Vitale, and that was an important question. This is an important priority for AARP, working to prevent medical errors, to increase reporting so people have more information, and to make sure that individuals aren't charged for the additional cost that occurs when an error occurs in a hospital. Congressman Pallone, do you want to talk a little bit about some of the healthcare quality issues that are happening on the federal level?
Well, again, you mentioned before, and Senator Vitale mentioned, that Medicare, of course, doesn't pay hospitals for medical errors. And I guess the question is whether we should expand that to, other government programs or just regular private insurance, which is what Senator Vitale would like to do on a state level. I mean, I certainly would be in favor of doing that on the federal level. I don't know that there is a legislation out there similar to his health legislation, but certainly I would favor that. There are a lot of models now about, doing things differently. When I was talking before about wellness and prevention and HIT, there were suggestions that we just operate differently. For example, there's this whole medical home idea. In other words, to try to coordinate care, the fear that you go to a doctor, then you go to a specialist, and then you go to a hospital, and none of this is really coordinated. And that we could coordinate it, by maybe, for example, having your primary care physician be in charge, and that even the method of payment is linked to that coordinating care. So these are some of the things that we're looking at, because I think there is a recognition that not only are costs going up, but quality is suffering, and some of these ideas, innovative ideas, may be incorporated into the healthcare reform.
Great, thank you very much. That was Congressman Pallone. I do want to give the results of the poll that we asked. We asked, have you been affected, or you or your family member been affected by a preventable medical error? And we had 35% of respondents saying that yes, they did experience a medical error either to themselves or their family member. So it's good that we are moving down on the federal and the state level to look at healthcare quality and try to create a better environment to prevent these errors from occurring in the first place. We just have to wrap it up, but I think we can take maybe one more phone call. We have Abby. Abby is going to be asking a question. Abby, would you like to ask your question now?
Hi.